Hi, I'm Jessica Kroll, Editor-in-Chief of Allure, and I'm here today for an amazing conversation around skin health and cancer. Many people know that cancer will affect 40% of Americans in their lifetime, but they don't know the effect that skin care can have on their prognosis. So I'm here with two amazing professionals in the space. I'm here with Dr. Sanjay Juneja, who is a hematologist and medical oncologist, and you might know him as the Onc Doc on social media. You also have the Target Cancer podcast.
Correct, yeah.
I'm also here with Dr. Delphine Kerob, and you are the International Scientific Director of Roche-Posay, and you have many degrees, but you're a board-certified dermatologist with a degree in oncology radiation therapy. You also have a master's in biological and molecular sciences and clinical pharmacology. And you are currently practicing, you have a very busy schedule, but you're also practicing at St. Louis Hospital here in Paris, among all those other jobs that we just mentioned. But you two are both experts in the field. You have expertise, especially when it comes to skincare and cancer, and I'm so excited for the conversation today. You told me a stat that 40% of Americans will be affected by cancer in their lifetime. When we think of cancer treatment, we often think of the very visible side effects, but skin can also be heavily affected by cancer treatments. So tell me a little bit of why skin health is important to cancer treatment.
For sure. It's something that you bring up that's just so important, and which is why I'm so excited to have Dr. Delphine, who's a specialist in this area, because you can definitely have specific side effects with certain cancer treatments for all kinds of nuanced or different reasons. But as an overall concept, when you have cells that replicate really fast, which is cancer, right? Cancer cells replicate super fast, and oftentimes you're trying to slow that process down. The things that replicate fast in your body also take a hit in the process, right? So hair cells grow really fast, stomach and gut cells, grow really fast, and that's why you get nausea and hair loss, and skin grows really fast. And so even though you may not have a totally serious skin side effect that requires a hospitalization, you can still have profound dryness and problems that delay treatments, but you can also end up having compromised areas, meaning that there's an opportunity for infection to kind of really take over a bad skin infection or get into your blood. So we need to think about how can we make sure that these things are as resilient and robust for something that is not rare. And I know you can speak on that probably better than anybody.
No, that's true that the skin side effects of cancer treatment is something that is really frequent. I think it's more than 80% of people. And we've seen also this with the new treatments coming on the market, targeted therapies, monoclonal antibodies, immunotherapy, on top of chemotherapy as well that acts on very rapidly renewal cells. And what we also observed in our patients, but also in the literature, is that when there is a skin side effect, there is a strong impact on quality of life of the patients. And this is true for the most visible skin side effects, such as folliculitis that we can see under certain cancer treatment, like EGFR inhibitors. This is true for hand-foot syndrome that we can see under chemotherapy or targeted therapy, but this is also true with xerosis. Xerosis, which can be also associated with itch, also impairs the quality of life of the patient. So as we move forward, with this progress of cancer treatment, which makes also our patients living with cancer much longer, we can consider sometimes cancer as a chronic disease. We need to really understand the side effects of the drugs that they will be treated with. We need to inform them about the side effects. We need to prevent these side effects, and we need to manage it when it occurs or it's more severe, because there are different forms of severity of these skin side effects.
You spoke a little bit about prevention, right? And I think so much when you go in and you're dealing with this kind of life-altering diagnosis, the last thing you're thinking about is putting lotion on or really taking care of your skin, right? You're worried so much about how do I preserve my life? But I would love to hear you both talk a little bit about, you know, what you expect and prescribe your patients to do with their skin in order to prevent some of these negative side effects for the treatments.
For sure. And I think one thing that I just want to stress is the preventative nature. So, you know, I'll tell you, in America, unfortunately, a lot of people are talking about that now, but we wait until there's a problem to do something about it,
yes,
right?
We're very reactive.
Reactive. So, you know, you have diabetes now, suddenly let's change a whole bunch of things. But damage has already been done with those increased circulating, you know, sugar levels. You have heart failure now, or you've had a heart attack or a stroke. Let's do things now. But again, damage has already been done. That same concept very much applies to skin, right? Because you don't want to necessarily wait until there's a problem, especially when you know there will be a problem. So if you can do something over time, and this just happens over time, these behaviors need to be developed over time, just like with diabetes and nutrition. It's really hard to flip a switch. But if you're making sure that the UV damage that you get every single day is less, then you're damaging your skin less over time. If you're making sure that it doesn't get, you know, overly dry and having a lot of the chronic problems that happen over time, number one, that prepares you best for, you know, God forbid, should you have to have something that impairs it. And then to answer your question, it's very challenging, and that's why we need, you know, Dr. Delphines all over the world to really be able to categorize what exactly is happening with this process. Mm-hmm. If you've ever heard about something of, you know, chemotherapy as a poison and that's all it is, but then you also heard about targeted therapy,
right?
That, and got excited about it, that's a good thing. But remember, cancer cells have essentially, they were your normal cells. So there's nothing you can target that won't necessarily potentially be somewhere else on your body, right? Ever, because it's not a virus or a germ. So you're gonna get this kind of collateral damage. And that's what, you know, she studies so well, is what are the categories of the collateral damage and how do they present? Often very unpredictable when we make them. Like, people take it and all of a sudden the hand-foot-mouth syndrome. I mean, you could have an amazing response on a cancer, you pray and you're very thankful, and then you're told by the doctor we have to stop it because the ulcers are too deep. I mean, how tragic is that? And so, one, we need to study it, and two, if we can make those events happen less, especially as the complexity of these therapies get more nuanced, it can really be the difference maker. Because there's one thing to not have a cure or a treatment for cancer, but imagine having it and it not being an option for you, or having to throw it away as a treatment option. I mean, that in itself is its own kind of tragedy, and that's why I admire so much, you know, Roche-Posay and everything that is being studied to try to at least take that off the table as we're trying to go ahead and find ways to treat cancer better.
Well, absolutely, because the last thing you want to do when you are an oncologist is to stop the treatment or to decrease the dose due to skin side effects, when you know that you can prevent some of these. And there was, you know, one of the first study was a STEP study published in 2010 showing that you can prevent the occurrence and the severity of the skin side effects with a treatment regimen that you propose to patients under EGFR inhibitors. One of the most, you know, the treatment that is leading to lots of skin side effects, different kind of skin side effects. So, of course, the first thing was to understand, with a collaboration with oncologists, the different skin side effects of all these new treatments. And I like when you talk about targeted therapies, and the skin is one of the targets of this targeted therapy. Really? And there are different groups, different class of treatments that will lead to very different side effects. So I think the first thing is also to educate. Educate HCPs, including nurses who may have more time with patients, educate the patients, and then work with experts to do studies and to do also recommendations, consensus recommendation on how to prevent these skin side effects. And as we know that these treatments will impair the skin barrier, will induce inflammation in the skin, may lead to phototoxicity, photosensitivity. The first thing is very simple, is you need to have a gentle cleanser, gentle moisturizer, photo protection, and then depending on the treatment you will have and the skin side effects that this treatment may lead to, then you need to have additional tips to manage, to prevent and then manage. And of course, you need to have this conversation with the patient. It takes time. So this is also an issue that needs to be solved with other HCPs around the oncologist. And you need to follow these patients and sometimes to help them discuss about it with the oncologist. They need to know that there are solutions. Otherwise, what they want to keep their treatment and they prefer maybe not to tell about their skin issues because that may seem minimal in regards to the severity of the cancer.
Well, what you're both saying, I think, is so important for people to know. It's that, our skin is often on the bottom of our priority list, especially for Americans. We're very much so instant gratification culture, but the skin is at the bottom of our to-do list. But if it makes your treatment stop, it should be a priority when it comes to the care that you're taking. And the other thing, it's a daily practice, right? I'm hearing that, gentle cleanser, something that's not going to irritate or agitate. A strong and healthy moisturizer, probably additionally something that's occlusive on top of that. You all have the Cica line, the Cicaplast line that I think is also keeps moisture in, protects the barrier in that way. These are things that you can be doing on a daily basis, multiple times a day, to give you a better chance of having healthy skin throughout this process. Is that accurate?
That's accurate. You need to have moisturizer. Cicaplast is more for more localized areas, fissures, paronychia, sometimes hand-foot syndromes that the skin is painful and dry, and then you can really protect it and repair the skin that has been altered by these treatments. And this is simple things, but the first step is really to talk and to educate, and then to follow up on these side effects of the skin. And they are so different from one treatment to another. We are talking about systemic treatment, whether they are oral pills or injectables, but there are also there is a surgery, there is also radiation therapy, and they are also leading to side effects. And the last thing that the oncologists want is that even radiation therapy stops. It needs to continue to respect the frame that was decided at the beginning of the treatment.
That's such an important point, because with radiation, usually if it's in a curative setting or what we call adjuvant to kind of consolidate a cure, you have one shot. You have that 6 weeks, like 4 to 6 weeks depending on what the cancer type, and that's it. And the whole thought is damage that replication that's occurring continuously, right? And if you have delays, oftentimes with head and neck cancer and breast, the delays are because of skin sometimes, and imagine how that stays with the family forever. What if we did better with our skin? Right. What if we didn't have to delay it a week or a couple of days? These are the kind of things that at the end of the day may not make a difference. We don't know, right? Like in that specific patient. We know it makes a difference overall. We know that. But in that case, even if it didn't, you still wonder, would mom or dad or my spouse be around if we were more vigilant with the skincare? And I think that's super sad too. So it's more of just the assurance of you're doing everything you can. If anyone has heard about the concept of taking antibiotics and getting diarrhea or stomach problems, why is that? It's because the antibiotics are actually killing the good germs in your stomach, right? Well, cancer patients, believe it or not, we are 50% germs, like bacteria, fungus, and all this. Every cell, human cell we have, we also have a bacterial or fungal cell, like that. We're 50% germs, right. And so there's good ones. And with cancer patients, the chemo alone, but also the antibiotics, this, that, and the other, you're killing the good cells on the skin just like you are on the inside sometimes when you get diarrhea from antibiotics. So these concepts, which is why I was just enamored when I found out about La Roche-Posay, they're like, yeah, we thought about that. We put the good bacteria into the products to try to restore that which is missing. And regeneration, like we know it's impaired when it comes to cancer treatments. Yeah, we give it a lot of the nutrition it needs with selenium and a lot of the food that the soil needs. And I'm like, you know, you're really thinking about, it's such a multifactorial process, and it's nothing you can sleep on. Friction in areas, like don't just say it's redness and cracked. That crack is an opening for other infections to come in and delay treatments.
Now, you stepped right into all the questions that I had next, because I think so much, you know, we are speaking about how cancer treatments can affect your skin and obviously your body as a whole, but I wanted to know a little bit if there are certain areas in particular that patients should be putting extra focus on. I mean, obviously our skin covers our entire body, so it is our largest organ, but you know, you mentioned, I know if you have breast cancer, for example, you might have a port or things of that nature, and those areas can be susceptible to infections. So are there certain areas or certain things that when you're doing skincare as a cancer patient that you should pay extra attention to?
I think this is such an important concept, because that's where Dr. Delphine makes a huge difference, because there's two ways to think about this. There's one way, which is just the health of the skin overall, right? That is a concept, not to be mistaken, that depending on what therapy you're on, that it's the same for everyone. Everyone needs the first one. Everyone needs to not irritate the skin with chemicals and scented stuff. They don't want to take super hot baths. They want to use gentle stuff, trap the moisture, protect the barrier. All of that is applicable. Everyone doesn't want frictional wear in areas for fungus and stuff to be able to fester and grow and things like that. These are concepts that hopefully you get from your medical team, but you want the skin fortified. I mean, think about it as you wearing a big glove. Like in COVID, we had to wear stuff. You're wearing a glove. Do you want holes in it? Do you want frictional wear in it to where you can kind of see through? You want it really, you know, fortified. The important thing is that Dr. Delphine's helping us understand in all of oncology is the questions you need to ask your doctor: what is unique to the pathogenesis, meaning the cascade of events and where it acts and what part of the process. We're a bunch of ingrates on how complicated the body is. That's what she is very keen on, is it's not one size fits all. And it's so important to understand what process is happening. And this isn't an overstress because it's Roche-Posay. This is a reality. I mean, we know people get admitted and discontinue to super high double-digit percentages treatments because of skin problems. And so she screams from the top of her lungs, as sweet as she is, she's like, we need to figure out what and why and how, because the longer we wait, the more people suffer with a treatment option on the shelf. And I think it's very important to remember those two different pathways, and patients and families deserve more on the second part, which is what can I do about my unique cancer and my unique cancer treatment.
Absolutely, this is so true. A patient under capecitabine will have a hand-foot syndrome, inflammatory hand-foot syndrome, which is painful. A patient under EGFR inhibitors will have a folliculitis on the face, which will be very hard to cope with. They will have also paronychia, cracks on the hand and foot. They will have xerosis, pruritus. A patient under sorafenib will have hand-foot syndrome. I've seen, this is where my passion for this topic has started 20 years ago, when I've seen my first patient under EGFR inhibitors coming, and the pneumologist wanted to stop the treatment because of folliculitis of the face. And then my second patient under VEGFR inhibitor coming in a wheelchair. He was 30 years old. Under target, and he came in a wheelchair because of the hand-foot syndrome, hyperkeratotic hand-foot syndrome. And then I said, no, we need to understand first what happens, and we need to train oncologists so that they can understand what happens and help their patients. But the difficulty is that, you know, medicine is progressing so fast, and this is, we are so happy. We are living a revolution in medicine. So we are very lucky to live this revolution in medicine, in oncology, in dermatology. But then we need to run really fast after the progress and the new drugs and the new side effects, so that we can educate and continue. So it's a continuous movement, and we need to be in this movement and work with experts to then understand what happens this year and what will happen next year, and then build recommendation on ways to prevent with skincare regimen, basic skincare regimen, education, and then how we can manage with reactive skincare, and sometimes upgrade to a topical treatment, systemic treatments, and sometimes unfortunately, when the skin side effects are too severe, then we need to decrease the dose or stop the treatment. It happens, but we need to minimize this part.
So you just mentioned 2 treatments in particular that I would like to maybe learn a little bit more about, just so everyone can understand. So you mentioned folliculitis, and you also mentioned hand and foot syndrome. And I would like to know a little bit more about what the treatment for that, if you see that in a patient, or if a patient is diagnosed with that as they're going through cancer treatment, what is the general path forward for them for both folliculitis and hand and foot syndrome?
So folliculitis, you will see that under EGFR inhibitors, which are approved in lung cancer, head and neck cancer, colon cancer as well, and maybe other cancers, squamous cell carcinomas as well, squamous cell carcinomas, and they are leading to this folliculitis, which occurs on the face, on the trunk, sometimes in other body areas, very early on after the instauration of the treatment, and then you have other additional side effects that comes with this. It's normal because there are receptors to EGF on the skin. So it's a epithelial growth factor receptor. So epithelial, it's the skin. We are talking really about the skin. And there are now 2 randomized control studies showing that when you use systemic antibiotics plus topical treatments plus moisturizer and sunscreen, you can prevent these skin side effects, and you can prevent the severity of these skin side effects. Now, that's true that we also are looking, can we also prevent that only with skincare? So this is a question we are trying to answer in the next coming months. So this is for folliculitis. Yes.
Please, hand foot.
Yeah, and foot syndrome, we have, from my perspective, 2 types of foot syndrome. The inflammatory type that we see under capecitabine, and then the hyperkeratotic one that we see under targeted therapies, especially VEGFR inhibitors, which are very painful. And so for that, there are studies showing that urea-based cream can prevent these skin side effects, or can be helpful to manage it with also proper skincare, avoiding too harsh skin, let's say, alterations before and during the treatment.
Yeah.
If I may, that's very important, because the inflammatory is capecitabine. That's in colorectal cancer, which we know is just escalating so much in America. And then the other one that she was talking about was when you hear things like Vatinib or Zatinib. I mean, you will see so many treatments like that, and they inhibit blood vessel growth. And remember, blood vessels supply blood, which gives our skin nutrition. Like, that's why, if you're thinking preventative, to not have diabetes that decreases the circulation of blood to your skin, or to smoke tobacco that decreases the blood to your skin. That's why you get skin problems, because that's your nourishment. Right. And so if you're inhibiting and also messing with the pathways, you end up getting weird things that happen on the surface that can't necessarily be healed. That's one of the processes, but it's actually a little more complicated than that. But what I want to share is a story that I still think about. And it was this very sweet woman that had incurable stage 4 cancer. Darling, right? Never upset or angry about anything, even though it was incurable. And she always knitted these characters for Christmas. She did it for her church, all of her grandkids, everything. And it took her 6 months to do it or so. So we came into this very difficult decision around July, because she was terminal. I hate that term, but it is, it just means that she's going to pass away and her survival is not likely beyond a year. Doing well, we had to make a decision of continuing the treatment that may get her, 6-8 months on average, but not permit her to knit her potentially last Christmas for the thing that brings her so much joy for 20 years. So extensive discussion, ended up having to switch therapy to avoid something that was literally prohibiting her, even though the response was good. So the 2 things that I think about still, amongst a million things as an oncologist, is if I would have known that there was some kind of skincare product that did more than everything I said, trap everything, but actually, replenish with these selenium and these things, do the good, bacteria and microbiome, could we have kept the therapy going, right? So that keeps me up at night. And then the second one is, can we study these things more accurately, like the Hydrea cream, which I get very excited about, because now you're talking about something that could permit her to knit and not her and her family, as well as her family, get upset with her. Mom, why would you do this? Grandma, don't change this. You're doing well in this therapy. But as an oncologist, I can have private conversations where I knew what it would mean to her to not be able to do it ever again, that we had to make this difficult, decision. Just her and I. And she's passed away since then, and nobody else will understand. But the more tools we can equip with these decisions that are, at the end of the day, no perfect answer, the better we can do. And I think it frees a lot of family members and providers from the 3 a.m. thinking of, should I have done it differently? Could we have done it differently? More tools make those events happen less.
The thing that I think about so much is, in this case, skincare feels like medicine. And while you don't necessarily write a prescription for a cream, it can drastically change someone's quality of life. And I think we have to change the mindset of the importance of skincare when it comes to outcomes, right? This is directly affecting someone's outcome and someone's happiness. And I think that's so important. I want to thank you both for chatting with me today. I learned so much. I learned so much about prevention and what I should be doing with my own skincare in the future. And I also learned, my life has been affected by cancer, as many people's have. And now I feel, as someone who cares for my family, I know what to go and pass along to them and what care package to send them as they go through their journeys. So I really appreciate your time.
Oh, of course.
Thank you very much. It's so nice to talk with people who have passion around patients and how we can improve their lives. So thank you very much.
Well, of course, I couldn't agree more. Thank you both.
Thank you.